Welcome to Community Health Television, where community health is our concern. Kindly subscribe, like, and share. Measles is a highly contagious infectious disease caused by measles virus. Symptoms usually develop 10 to 12 days after exposure to an infected person and last 7 to 10 days. Initial symptoms typically include fever, often greater than 40 degrees Celsius, 104 degrees Fahrenheit, cough, runny nose, and inflamed eyes. Small white spots known as complex spots may form inside the mouth 2 or 3 days after the start of symptoms. A red, flat rash which usually starts on the face and then spreads to the rest of the body typically begins 3 to 5 days after the start of symptoms. Common complications include diarrhea, in 8% of cases, middle ear infection, 7%, and pneumonia, 6%. These occur in part due to measles-induced immunosuppression. Less commonly seizures, blindness, or inflammation of the brain may occur. Other names include morbilli, rubeola, red measles, and English measles. Both rubella, also known as German measles, and roseola are different diseases caused by unrelated viruses. Measles is an airborne disease which spreads easily from one person to the next through the coughs and sneezes of infected people. It may also be spread through direct contact with mouth or nasal secretions. It is extremely contagious. 9 out of 10 people who are not immune and share living space with an infected person will be infected. People are infectious to others from 4 days before to 4 days after the start of the rash. Most KM people do not get the disease more than once. Testing for the measles virus in suspected cases is important for public health efforts. The measles vaccine is effective at preventing the disease, is exceptionally safe, and is often delivered in combination with other vaccines. Vaccination resulted in an 80% decrease in deaths from measles between 2000 and 2017, with about 85% of children worldwide having received their first dose as of 2017. Once a person has become infected, no specific treatment is available, although supportive care may improve outcomes. Such care may include oral rehydration solution, slightly sweet and salty fluids, healthy food, and medications to control the fever. Antibiotics should be prescribed if secondary bacterial infections such as ear infections or pneumonia occur. Vitamin A supplementation is also recommended for children. Signs and symptoms. Symptoms typically begin 10 to 14 days after exposure. The classic symptoms include a 4-day fever, the 4 Ds, and the 3 Cs, cough, coryza, head cold, fever, sneezing, and conjunctivitis, red eyes, along with a maculopapular rash. Fever is common and typically lasts for about 1 week. The fever seen with measles is often as high as 40 degrees Celsius, 104 degrees Fahrenheit. Complications. Complications of measles are relatively common, ranging from mild ones such as diarrhea to serious ones such as pneumonia, either direct viral pneumonia or secondary bacterial pneumonia, laryngotracheobronchitis, croup, either direct viral laryngotracheobronchitis or secondary bacterial bronchitis, otitis media, acute brain inflammation, and very rarely subacute sclerosing panencephalitis, and corneal ulceration leading to corneal scarring. In addition, measles can suppress the immune system for weeks to months, and this can contribute to bacterial superinfections such as otitis media and bacterial pneumonia. 2 months after recovered, there is a 11 to 73% decrease in the number of antibodies against other bacteria and viruses. Treatment. There is no specific antiviral treatment if measles develops. Instead, the medications are generally aimed at treating superinfections, maintaining good hydration with adequate fluids, and pain relief. Some groups, like young children and the severely malnourished, are also given vitamin A, which acts as an immunomodulator that boosts the antibody responses to measles and decreases the risk of serious complications.